Okay, so why don't we get started? I know we have a lot to cover, and in the meantime, as everyone's joining in, just welcome. So Shalom Alochon, good afternoon, everybody. For those of you who don't know me, my name is Dr. Tiffany Tatevossian, and I'm a board-certified internal medicine physician. So I specialize in adult medicine. I just want to start off by thanking our wonderful association for inviting me to be a part of this wellness retreat and for asking me to join alongside with all the other wonderful speakers, because it's truly my pleasure and honor to be here today and to be asked to conduct this live COVID-19 forum for you all. Because I would like to help our members in our community in any way possible, always, especially during these very difficult times that we are all unfortunately going through. So thank you again to our association. Throughout this session, everybody, please feel free to leave messages. I'm checking it out as I go along, or comments or questions that you would like me to answer, and I'd be happy to get through as much as I can. I have the screen that I'm looking at. I got my phones here, and actually, just before logging in, I checked the Instagram account and my email account, and you guys all, most of you already submitted some questions. I did not get a chance to go through them, but I printed them all here so we can go through them one by one live together. So just as a quick brief background about myself, I received my Bachelor's of Science and my Master's of Public Health both from UCLA. Then after I graduated from UCLA, I pursued my MD from the University of Missouri, Kansas City School of Medicine. Once I graduated from medical school, I then pursued residency training through the East Coast at New York Medical College at St. Joseph's Regional Medical Center. After graduating from residency, I actually worked and practiced outside in the East Coast for about a year, and then I moved back to California, where I'm originally from, and I joined a wonderful group here, which has been an amazing experience. So as a physician, in terms of my current clinical work and practice, I generally work in two different clinical settings. So I could be either working at the office or at the urgent care. And so what that means is, for the most part, in any given day, I am helping treat and seeing patients, all of the adult population, with myriad medical problems, anywhere from acute to chronic cases. So we get quite busy. But since this pandemic, my role has definitely increased. And so in any given time over these past few months, I could be potentially working either at the office, at the urgent care, or at the hospital or ICU taking care of the patients there. In fact, it was just recently that I was rotating through the hospital and helping care for all of the COVID-19 patients in the COVID unit floor. Another way that I've been reaching out to all of our patients, and I'd like you all to know about so you can do the same with your own physicians, which I'm sure have this in place, is through telemedicine. So now, telemedicine is something that my colleagues and I had incorporated into our schedule even prior to this pandemic, and I'm definitely utilizing that at this time as much as needed and of course when appropriate. So over these past few months, I have been helping care for COVID-19 patients in many different clinical settings, and I am continuing to do so at this time. So now, just a few things I do want to make sure I get addressed today in regards to this very important topic. And again, feel free to submit in your questions, and I promise to go over everything I just printed out from you all. But just briefly, some of the things I do want to make sure we all have a good understanding on is some of the terminology that we're using a lot these days, as physicians, as healthcare providers. So, for example, when you all hear the term COVID-19, what we're actually referring to is the disease. So, coronavirus disease 19. And this disease presents in many different forms, and we're seeing that more and more each day. But the virus that causes this disease is what we actually refer to as SARS-CoV-2. So now, back in 2002, 2003, we were faced with another new type of virus referred to as SARS-CoV. And though that is a very different virus than what we're going to focus on today, one thing I want to briefly do is to kind of give some ideas of the things that we faced in the past as physicians and healthcare providers, to kind of give perspective in terms of the comparison of why we're actually so concerned about this new virus we're facing today. So going back to the past when we faced with SARS-CoV, that virus was a zoonotic virus that came from animals and jumped to humans and was causing severe disease in individuals. It was also being spread from person to person throughout the world, but not so easily, in the sense that the individuals who were infected with that virus, in order to really pass it on of that time and that virus, they had to be quite ill or showing and displaying a lot of symptoms and in close quarters with someone. So because of the particular nature of that virus, along with other things, the physicians and the healthcare providers that were working during that time were actually able to safely quarantine all those individuals affected to the point that they actually managed to stop the spread of that virus. And so in terms of today, after so many years, we actually have not seen that virus re-emerge into the environment or be spread from person to person. And there's important points where I'm getting at with this. So now, let's just fast forward years down the line. There was yet another new virus that we all faced, and it was another new type of coronavirus referred to as MERS. And so what that stands for is Middle East Respiratory Syndrome. Now that virus emerged in 2012. It also came about from animals to humans and causes severe disease. But while that virus was spread from person to person, for that virus, not so easily, in the sense that, once again, it was a type of virus that actually did not emerge across the entire world, but unfortunately did affect various parts of the world. So now, let's fast forward even further to today, our present time, where we're unfortunately faced with yet another new virus, a novel coronavirus referred to as SARS-CoV-2. Now, what that stands for is Severe Acute Respiratory Syndrome, CoV, coronavirus 2. Now, of course, the other term you're all hearing today is the term coronavirus, but just as clarification, there are actually many different types of coronaviruses out there, and some of which we actually have known about or been exposed to the sense that those very different coronaviruses could cause what we might refer to as just the common cold, with very, very mild respiratory symptoms. And so when you're hearing the term coronavirus, if one may ask, well, what exactly are coronaviruses? So in essence, if we want to just get to the very, very basic of the microbiology of them, they're in essence positive sense, single-stranded enveloped RNA viruses that are a part of a family of viruses referred to as Coronaviridae. So now, as a quick recap, SARS-CoV-2 is a novel coronavirus, one we've never seen before, one we've never been immune to before. This virus is causing the disease COVID-19, a disease that is presenting, unfortunately, in many different symptoms and ways. And with this particular virus, it appears to be a zoonotic virus that unfortunately adapted to humans, and now we're faced with it today. So now, while there are very many concerns about this virus and the disease that unfortunately it causes, one of the concerning things about this virus is that unfortunately, unlike some of the other viruses we were mentioning that I was mentioning that we've seen before, this particular virus is being shown that it is easily transmitted from person to person. So easily so that even individuals with the even mildest of symptoms can actually, unfortunately, spread that to all of those around them. And those individuals that get affected may not be so fortunate to have such mild symptoms. And the other problem, or amongst many problems about this particular virus, is that in addition to it being easily spread by very mildly symptomatic individuals, it is also being shown that it is being spread by asymptomatic individuals that are carrying this virus. And so why that is of particular concern is because what I mean by the term asymptomatic is an individual that actually is displaying 0 symptoms. So much to the point that they actually feel like their normal self. They're unaware that they're carrying this virus that could be potentially very dangerous to those around them. And then, unfortunately, they can actually spread that virus, if they're not careful, to multiple individuals around them. So much to the point that those individuals, again, may not be so fortunate to have such mild or asymptomatic symptoms or a state. Instead, they can actually be affected so negatively that they can develop severe or life-threatening conditions. And so the reason why I did want to start off with giving that little intro is just to give a perspective of what it is we're facing these days. And maybe even so more point now than ever as things are slowly opening up, as you are aware. So just as from a physician standpoint and from someone who cares very much about our community, I just want everyone to just please be safe at this time. And be aware that the fact that things are opening right now is not an indication from a physician or healthcare standpoint that the virus has disappeared. Unfortunately, it is still very much here at this time. Okay? And so welcome to all the others that I've been seeing joining in. So now, for those of you who are just joining, I had received a bunch of questions that you had all submitted to our association, some that you guys sent to my email account and some through my own Instagram account. So I printed them all here, and I'm going to go through them all one by one. But please, throughout, if you need clarification on something, or if you feel like I might have missed your question, submit them through, and I promise I'll do my very best to get through as many questions that you guys have as possible. Okay, so let's see what the first question said. So here, one of our viewers asked, what is COVID-19 exactly, and how does it attack one's health? Well, great question. Thank you for asking that. So it appears that I answered the first part of that question already in the beginning of this. But in terms of the other question about how does it attack one's health, so based on current research, it appears that it is being spread through respiratory droplets. So for example, if someone's coughing or sneezing, and we happen to come to path of those respiratory droplets, that can get into our respiratory system, and unfortunately the virus can then start multiplying and can start causing disease within our own body. But thank you for asking that. Great question. The next question we had here from one of our viewers, why are we being asked to wear face masks in public? Oh, thank you for asking this question. I feel like this is one that comes up a lot. So for many years and for time, it has been shown that masks actually do work in limiting the spread of respiratory droplets, but also they're even being shown to slow down the spread of speech droplets, so by talking. And there actually is a study that was published by NIH, the National Institute of Health, in the New England Journal of Medicine that did demonstrate that wearing a mask did limit and lower the amount of even speech droplets that were being transmitted. So that's kind of an important feature about that. And the reason that's important about the speech concept, because as we mentioned, I was telling you guys earlier today, the asymptomatic individuals that are carrying this virus can actually transmit it to those around them. And so if people wonder, but how? So if somehow any of their, whether it's respiratory droplets from accidentally coughing or sneezing without covering their mouth, or even from speech, can spread. But if they're wearing that mask at this time, while we're currently in this pandemic, they can help lower the spread. So that's the main reason. It is also a great safeguard for all of us. Another way, I suppose, you can also look at it to give another perspective of it, for all of you out there who've ever had surgeries or procedures, And if none of you have had that at any point, eventually in the future, when you hit certain screening times, you're going to have to go through some screening procedures. And I had to throw that in there because I am an internal medicine physician, so I'm very big about preventative medicine. But in any case, my point to that is, as patients, when we undergo any kind of a surgery or procedure, you will notice that all the physicians, so the doctors, surgeons, your anesthesiologist, any rotating nurse in the operating room or procedure room, whether that is your scrub tech, the circulating nurses, anyone who decides to step foot in the OR needs to wear a mask. And that's to protect the patient. And they need to wear that mask even if we're asymptomatic. So for me, as physicians, we've all gone through training where we've scrubbed into surgeries, and I even was able to several times even help assist in surgeries. And there wasn't a way that I would even enter or be allowed or permitted to get into that operating room if I myself was not wearing a mask. So it's a great form of safeguard all around. Okay, thank you for asking that. So let's see, the other question here, is it safe for me to donate blood during the coronavirus pandemic? Wow, thank you for asking that question. Yes, so the need for donating blood is actually constant. And even the CDC will encourage all those out there who are feeling well and who are willing and able to donate blood to please continue to feel free to do so. The CDC does work very closely and supports blood centers to make sure that in addition to the patients or individuals that are there to go donate blood, that they're safe, as well as the staff members. So please feel free. That is a wonderful thing. We're always in need of blood donations. The next question here appears to be from another viewer. So how do we know it's safe to discontinue self-isolation? Oh, this is a very great question as well. So this actually is very much dependent on what particular state you're in. So for example, let's go towards the individuals who have been diagnosed with COVID-19. So if an individual is diagnosed with COVID-19 and had symptoms from it, what they have to actually do in terms of when they're getting safer to go out in public is to make sure that at least 10 days from the time of their symptom onset, they have shown progress and significant improvement of their symptoms, as well as, in addition to that, they need to be sure that they're also afebrile for 3 consecutive days, and from that point on, basically, without any antipyretics. And so what I mean by that is that you should not be having a fever, and you should not be having a fever in terms of without taking any antipyretics, which means medications that reduce your temperature. So for example, I've had patients myself. I would always call and check on them when I wasn't with them. And if they were to tell me, hey doc, I have not had a fever over the past 3 days, and I've been checking my temperature. And then one of the questions I'll ask is, did they take anything for lowering their fever? They would say no, but sometimes we'll forget that Advil, Tylenol, Motrin, Aleve, these are considered fever reducers. So even if you are happening to take that medicine because of a headache or something, and it wasn't because you thought that you were febrile, if you're continuously taking those medications and checking your temperature after, you may not know that you're afebrile or not. So what I tell my patients is always to make sure they're checking their temperature prior to taking those medicines, make note of it, and then we check on them. Now, while that's the current guidelines right now, and I want to put that as a discretion for everything we're discussing today, things are rapidly changing in terms of our guidelines and things like that, and I know it can probably be, a little bit frustrating from a public standpoint, and we get that, but it's because it's a new virus and we're learning new things. So whatever we're discussing today is present guidelines. It could change in the next 24 hours to 48 hours or even in the next few weeks. But the more you have that time away, at least 10 days, the safer you are. From that point on, though, those individuals need to make sure that you're wearing a mask before you go out in public, because you may be shedding that virus still unknowingly. And so The other scenario for that, about this discontinuing self-isolation, is let's say there's an individual out there who is completely asymptomatic, but they actually tested and got diagnosed with SARS-CoV-2. So if you're asymptomatic, no symptoms, but you got tested and that test confirmed that you are positive, at that point, the current guidelines are you need to self-isolate, quarantine, and wait at least, again, 10 days from the day of that first positive test result. Now, let's say you are waiting those 10 days, but then all of a sudden on day 10 or 11 or 12 or any 14, 15, whatever date it is, you develop symptoms and become febrile. You need to very well connect with your physician and make them aware and understand now things are going to reset and you're going to have to quarantine a little bit longer. The other scenario about the self-isolation in regards to this question that was asked is, let's say you don't think that you have SARS-CoV-2 and you're fine, but then all of a sudden you accidentally got exposed to an individual with COVID-19 positive and you found out. So for those individuals, you do need to quarantine under today's guidelines. And so even if you don't have symptoms, you just got exposed, you have to count at least 14 days. So this one is 14 at least, from the day of your last exposure to that individual, and then continuously monitor your symptoms. If after the 14th day mark you don't become febrile or develop any symptoms, because as we know today there's lots of different symptoms out there, and if you're unsure, again, please call us, call your physicians, we will help clarify that for you. But wait that long, and the reason is because what we're noticing is generally symptoms will start to appear, although there's no 100% rule or guideline, but for the most part it's showing that it's between 2 to 14 days, okay? So that one is for that situation. Thanks for asking that question. That is a good one, and in fact, we get asked that a lot. The next question here we have from one of our viewers out there, and again, thank you to all of you who submitted these questions. Hello, I'm seeing a lot of people joining in. So the next question is, am I at risk for serious complications from COVID-19 if I smoke cigarettes, vape, or smoke hookah? Okay, great question. So separate from COVID-19, recommendation from us as physicians and a healthcare standpoint is always to please go towards cessation of those activities. And even separate from COVID-19. The reason is because, as we know, all of these can cause severe lung disease as well as a lot of other complications, and these are things you don't need ever in your lifetime, and not now either. So they affect your respiratory system, correct? And so with COVID-19, one of the serious forms of this disease is that it affects your respiratory system. So a lot of the people that are struggling out there, and even the ones that are, struggle but recover, they'll display, sometimes some patients will display like fever, cough, and shortness of breath. And they're desaturating. So what that means is their oxygenation levels are going down. So the less you have any kind of things affecting your lungs, the better overall. And I'm actually glad that whoever asked this question did mention the terms vape. And of course the hookah, because these are also not healthy for you. And I'm only clarifying that. I'm sure many of you already know this, and maybe all of you know this, because I have noticed in my younger patient population, I have had a lot of individuals come in, younger patients, saying that they switched to vape or hookah because they were under the impression that it was fine and safe and it's not as bad as cigarettes. So vape and hookah are still very bad for you. And in fact, in terms of vape, which seems to unfortunately be like a newer trend these days among some individuals, vaping has been shown, and we've had patients that did not survive as a result of the bad side effects from vaping. They all of a sudden got lung injury and serious complications. So these are unsafe practices. So from all standpoints, and as a physician, please try to quit. If you have difficulties with quitting, like cigarettes, we understand that's addictive. Contact your doctor. If you can't do it on your own, we have ways and programs and patches and things like that we can give and prescribe to you to help you out. We're here for you in all aspects, okay? Next question here from another viewer was, where can I buy hand sanitizer? Great question. And if I can't find it in the store, can I make my own? Okay, actually, this question is also another great question because it brings up some important topics about that. Well, first of all, if you are searching for hand sanitizer and you're unfortunately not able to find it in your local markets, what you can do is you can also check online. Some things are available still online, some are sold out. But actually, another reason why I'm happy this question got brought up, because I want to clarify something here. If someone was to ask, and we've been asked these questions before, what's better? Should I wash my hands or should I use hand sanitizer? Or do I have to do both? No. The best answer for that, truly, is good old-fashioned hand washing, soap and water. It is much better to do. So if you have the opportunity and you're in a scenario where you have access to a sink and soap and water, that is recommended for many reasons. But it is important that you're doing appropriate hand washing, so for at least 20 seconds. Warm water, dry your hands really good. Now, separate from that, why that actually is more important for many reasons is there's actually, separate from SARS-CoV-2 and the whole COVID-19 concern, there are different things out there, like certain bacteriums, that if you were to have accidentally got on your hand sanitizer won't work on them. And one of them is called C. diff. And I know that would be a whole different topic, but I'm just giving you a brief example that if somehow somebody accidentally got that bacterium on their hands, which yes, we generally see it more in the hospital setting, but it can be other areas because it is infectious, and you happen to put a bunch of hand sanitizer in your hand, it won't work because it releases spores and it needs actually the soap and water. So even as physicians, we prefer that. Now in terms of can I make my own? So I'm glad you brought this up. So from a physician standpoint and public health, we would never ever directly recommend someone to go try to make their own. And there's reasons for that. So I am aware, and my patients will tell me they're doing this, that some people are mixing like aloe vera gel with isopropyl alcohol, which is basically rubbing alcohol. But the reason we're not recommending that is it really should actually be made by a professional who does that as part of their job and is familiar. Because the concentration of how much you use matters. And if you do too much, it could be too harmful to your skin. In fact, I've been also getting a lot of patient cases that have come in and they developed what's called is contact dermatitis, some kind of inflammation you get on your skin, basically, and it was because they had a reaction from the hand sanitizer. Now, this won't happen to everyone, but my point is that using too much of something may not be beneficial. So my advice would be to avoid it. If I myself am not having access to hand sanitizer, and actually my preference is always soap and water, or let's say you guys do have hand sanitizer, but you forget it, and you're running errands and now you're worrying because you're worrying that your hands are not clean. It's okay, because the most important thing, when you leave your home and you go out, whether or not you have hand sanitizer or not, that's fine. As long as you're being conscientious about the fact that, remember, try to avoid, so your hands, if they're not clean, you don't want to touch your eyes, nose, or mouth. And the reason is because if you happen to catch something on your hands, you can then get that into your eyes, nose, or mouth and cause symptoms to start developing. So if you're out and about, just don't touch your face, try to do that, and then when you come home, and definitely before you eat, be sure that you're just washing your hands thoroughly. 20 seconds, soap and water. Really, that's all you need, okay? But thank you for that question. All right, we got some more questions here. Oh, I just saw a question pop out actually before I even go through. Hello. It looks like it's Alina. Thank you for that question. So before I go on to the rest, so I don't miss them because things are scrolling up quite fast. So one question here I see is if you get COVID, can you get it again? And the other question also is if you have antibodies for COVID, does that mean you won't get it? Thank you so much for asking this question. So this is a new virus and we're learning a lot by this day to day. And so right now, there is still a little bit of uncertainty about that in terms of can you get it again? And that brings along the whole important fact about the antibodies. So why that is so let's say somebody got antibodies for it because they actually knew they had COVID-19, not from a test, they became symptomatic. Right now, we're unsure, but that's why we're doing studies and we have epidemiology studies going on. How long are we immune? So this is important for so many reasons, including once those antibody tests become more accurate. Because just as a FYI, Right now, studies are indicating that whatever antibody testing is going on right now, they're showing a lot of false results. So you got to be very careful. In fact, even at our own institution or my group right now, we're not yet doing them because we're in the process of doing a lot of testing to make sure that once we start doing antibody testing, it is fully accurate. So let's go back and just for one moment, I guess for argument's sake, pretend that one of us got an antibody test and it was for sure accurate that the antibody it picked up was SARS-CoV-2. So remember, we have to be careful because if these antibody tests accidentally pick up another type of coronavirus and it wasn't SARS-CoV-2, we wouldn't know. But let's assume that it was accurate, just for one moment here. What we don't know yet is how long are you immune for. And so if we want to put this in connection to other diseases that we know about, so for example, the MMR vaccine, measles, mumps, and rubella. So children will get this at a young age, and then so what happens? Over time, they get the vaccine. Usually that vaccine, people will have the antibodies and be protected for many years, but eventually you wear off on antibodies and sometimes you need a booster. So for us and a lot of actually schools and programs, especially the healthcare programs for nurses, doctors, or any of those, they'll require their students to get retested for the antibodies. And the reason is because as we know with the MMR, over a many years span, it could start to wear off. But with this test and these antibodies, it's new. So we actually don't know. It could be that someone might get affected one day and we are unclear about can they get reinfected? Is it going to be months from now, a year from now, or years from now? So because of that, if any of you out there know of someone or are aware of someone who either got tested for the antibodies or they recovered from COVID-19 and then they feel like I'm never going to get again, I can go out and not wear a mask or anything, that's incorrect at this time because we don't know how long you're protected for. So thank you for that question. So another question that's here from what you guys sent to me earlier, it looks like, what advice can you give people about traveling during the COVID-19 pandemic? Oh, great question. The most important advice about this is to plan ahead. You want to make sure that you're researching exactly where you're going, and how their guidelines and rules are. Because, for example, unless they change that, but my understanding is as of recently, if you were to go visit Hawaii right now, you need to be prepared to understand that what they're doing for all the travelers that are coming there is they will actually have them. It's an enforced thing that they're doing is to make sure that they're quarantined in a different area in a selected designated spot of Hawaii before they can actually continue their vacation. So you really want to plan ahead and be certain where you're planning to travel and that you don't get any surprises because that could affect a lot of things. The other thing is that when you're going to the airport and things like that, still try to be careful because you're now with a lot of people that you don't get too close to anyone. Same thing, you want to practice these same social distancing and guidelines that we have. Try to wear your mask, keep distance, wash your hands thoroughly before you eat or get a snack from the airport. And then if you're going to go sit and relax, just be conscientious of your surroundings because unfortunately we can't really predict what other people might be doing and what practices they're doing. So if you have the opportunity and you see empty seats, be distant, sit away as much as you can, and just be cautious not to touch, again, your eyes, nose, and mouth. That was a great question because I'm sure more people are going to start traveling these days. So here's the other question from one of our viewers that they submitted. So thank you again to all of you. For those who are positive, what is the treatment? Great question. So at this time, we're still undergoing a lot of clinical trials that are underway and being studied. So we don't have things definitively answered right now. I mean, we're doing clinical trials not only here in our state, but across the country and worldwide. So as physicians and healthcare providers, all our researchers, we're all collaborating and learning from one another. So it's really important about making sure that we're just careful at this time until we come up with the right treatments for that. But one thing to keep in mind is, so for example, if you're on medications for your other medical problems that you may have, your chronic medical problems, you still don't want to neglect that during the time. So if somebody's COVID-19 positive, sometimes it's just really self-care measures. Like for the people who are at home and they're managing themselves okay, and they're not requiring oxygen, or needing hospitalization, those individuals we're checking on them, and we're letting them know that should anything go wrong, you don't feel right, 911 emergency room. But if you're maintaining, it's mainly the antipyretics. If you see that you get a fever, you need to take either Tylenol or Advil even. I know there's different things going on about that, but right now no studies have confirmed or proven that you can't take these kind of medications. That actually will depend, though, on your medical history. So not everyone can take Tylenol, and not everyone can take the NSAIDs, the non-steroidal anti-inflammatories, because, for example, if somebody is allergic to Tylenol, they can't take that. They have to go to the next medicine. And if someone has an allergy to the NSAID family, or have kidney failure, or have a gastric ulcer, or bleeding concerns, they need to be careful. So I suppose the best answer for that is make sure that you're talking to your doctor. You really want to make sure that you're communicating with them, because the management on how to help you recover is individualized. Everyone's different. Not every medicine or thing works for any one given person. Okay? So the other question here looks like for those returning to work. Oh, great question. Can they establish effectively safety protocols? Yes, thank you. So yes, CDC actually has guidelines in place both for the employers and employees. So that's something to check out and follow. But overall, the most important thing is, even in a work setting, you do want to make sure that you're very cautious, and you want to practice those safe practices. So, if you guys can still sit away at least 6 feet apart, if more, even better. You want to wear your masks and things like that. If you're uncertain, if you're an employer or you're an employee and you have questions, or you're not sure if it's applying to your, for example, situation or your job, because every job is different, you can contact your physician. We'd be happy to tell you, because we're familiar with the different work settings out there. We've gotten lots of calls. But other things that you can do, let's say from an employer standpoint or from an employee standpoint, to see if this is available. For those of you out there who have your own businesses, for your business's safety and everyone else, if you're able to still continue for now at this time, do some of the remote work, that is great and recommended for safety. If your job is requiring individuals to actually be in, and you need people, some manpower there, what you can also maybe suggest doing, and I know other jobs are doing this right now, where they'll kind of alternate between some individuals working remotely, and then they'll switch off and some at the work, so there's not too many people in the work setting. If you're requiring all hands on deck and everyone needs to come to work, the temp checks and the screenings are important. It's good to have a very good communication. So whether you're an employee or an employer, there should be a very strong communication for safety nets and backgrounds. The temp checks are not bad ideas, but we shouldn't only depend on temp checks, because remember, with COVID-19, some individuals can have no fever, but they still have COVID-19. So if anyone is feeling ill and they don't feel well, please contact your employer and let them know, if anyone, so that they know to keep you home. If there's an issue with that, contact your physician. The number of work notes I've possibly written off work notes to help protect jobs and patients is tremendous at this time, and that's okay, and we're prepared for that, and employers have been respecting that. They want everyone safe. Another important thing actually to help the work setting. So for example, if you find out one day, so you've been working, that you got COVID-19, you tested, and you got positive, it is critical that you please tell your employer and let them know. And the reason that's important is because if you were at work all that time, they need to kind of try to figure out who might have been exposed to you. And that's important because of that first guideline that I informed you before, that people need to make sure they're quarantining for those 14 days of exposure. So if you happen to be working with someone very closely, that could have been an exposure. And for their safety and the safety of others, it would need to be in place. Okay, so great question. There's, I think, another one here. Did I go through this one? No. Are there any vaccines or other medical products to prevent COVID-19? Okay, great question. Nothing is definitive at this time in terms of the preventative measures for treatments and things like that, because we're still undergoing research and a lot of clinical trials. In regards to vaccines, that's what we're all working, the scientists and everyone, researchers are working on right now. They need to be safely tested. They need to be verified. They need to be safe before, mass public vaccination. So we're not quite there yet. And so because of that, we do need to be very cautious about that. And I think earlier, in case it doesn't come up on here, I saw a question come up, and I'm sorry, I hope I'm not missing your questions. I know everything's scrolling fast, but one thing that came up from someone was asking about, what was it? What are they saying about COVID living on surfaces? Okay, I know you guys are probably hearing mixed things at this point, and the more research is done, the better. At this time, even as physicians and from a healthcare provider standpoint, we're still taking the precaution of just to assume if the surface might be. If we all assume that surfaces may have contamination, I suppose, from this virus, then, and we keep that in mind, we'll be conscious not to accidentally transmit it. Now, there's different things about that. So sometimes they'll say, like on cardboard boxes, it might just be on or survive for 24 hours. Plastics versus masks. I mean, there's some things out there indicating for us that it might survive on a mask of ours, like one of our N95 for 3 days. So we're conserving masks these days and trying to get them cleaned. So we might leave them out. Now, nothing is guaranteed yet at this time because, as you know, it changes from day to day. There'll be something new about that. So it's important to be very careful and just assume that this might be clean. Let me just wash my hands after I use it. That's the safest way to be because it's medicine. And with this virus, why things are also so much changing, it mutates and it changes. So whatever it's doing today or yesterday can be very well different from what it does tomorrow. For packages, I know a lot of people get concerned about how they got delivery and something was traveling through. Most of the time, I mean, for the most part, if you think about it in ways that whatever's inside the box has already likely traveled days. But again, just to be safe, you can just make sure to take things out, and once you touch the products or the mail, you can just wash your hands, and then you know you're safe, okay? So great question. Thank you for asking that. Let's see here. Another question that came through, and hello everyone who's joining in. So the other question here is, what are some things I might be doing that put me at serious risk for complications from COVID-19? Great question. So the most important thing actually, always, and definitely in this present time, is to be sure you're just trying to live a healthy lifestyle. And so especially for everybody, and if you're considered a high-risk category, so if you have other chronic medical problems, don't neglect them. Don't be afraid of the fact that COVID-19 is going on, and please don't feel afraid to contact your doctor, or if you need to go to the emergency room, like for example, if God forbid somebody's having chest pain or stroke-like symptoms, don't ignore those symptoms. Don't delay. You go call 911 as if there was no pandemic, because from a healthcare standpoint, we want to make sure people are not neglecting their health. If, for example, you're diabetic, so healthy lifestyle and exercise as tolerated is very important for everyone. But if you happen to be a diabetic, so one thing that you would do that could actually put you at risk is if you're not getting in control of your diabetes. So the healthier you live, that is the most important. And then from there, at least we know you're being safe. Now, another thing is that in addition to that, so for example, even for the diabetes example, and those who are diabetics will know what this is, but you want to make sure your A1C is controlled, and that means healthy diet and your sugar's under control. If that number is greater than 8, those individuals are considered more at risk. We got another question that came here. Let me make sure I get that before I move on. So thank you for all these questions. The next question here is, when we wear masks, we are breathing back in our CO2. So isn't that problematic since we need oxygen? Thank you so much for bringing up this question. So when you're wearing masks, you will be fine, because remember, the masks that we're requiring out there for everyone to wear, you're still going to get, your O2, CO2 exchange that you need. They're not for us, and again, back to the surgeon standpoint, or as physicians, think of it this way. Your surgeon even is wearing that mask for hours. If they have an 18-hour surgery, they're scrubbing it in, they're fine. You're getting enough of the oxygenation and CO2 exchange. The ones that are more difficult, that can cause people to be a little bit more symptomatic. Good news is you don't need to wear those in the public. Those would be like the N95s. Those masks are very sealed, and those ones provide a little bit more discomfort when you're breathing. But even those you would be okay in, and I can tell you that from experience because, again, when I'm working with my patients, I'm being very realistic when I'm telling you this and honest. I have that mask on the entire shift. I usually get so busy, and also not to cause cross-contamination, I don't have a chance usually, and I haven't, to go get a water break or to eat. So for the entire time of my shift, the N95s, which are much stronger than the basic mask, and that I'm wearing only in certain settings, because while it is respiratory droplet transmitted, with us as physicians, there are situations that we can be in where it's aerosolized. And so, you know, if there's a procedure going on or we're too close, there's not enough airflow, the patients are usually, you know, coughing and they're not feeling well. So we have that mask. And actually, in addition to that mask, normally what we're doing, because we have to have layers on, and then we're, you know, it's called donning and doffing, taking off our PPE, putting on our PPE. So we're at risk of cross-contamination. So we usually actually have N95 surgical mask just to keep it a cleaner surface as much as we can, because sometimes we have to conserve and then get cleaned, and then not to have any kind of disruption of the material. And then we're wearing the shield and the goggles or whatever. So I've worn it and I'm fine. Your oxygen CO2 exchange will be okay. I know there's some misunderstanding about it not being, but you will be okay, and you shouldn't have any negative problems to that. But thank you so much for asking that. So the next question here, and again, feel free to submit more in case you guys didn't already submit these ones last night. So what are the some of the high risk categories? Great question. So based on what we know, one of the high risk categories would be age greater than 65. Other things would be for individuals living in nursing homes or long-term facilities. There are also, so individuals not age greater than 65, any actually age group could be at high risk if they have like other underlying medical conditions that are of concern. So for example, severe obesity is considered a high-risk category. So that is when your BMI or body mass index, for example, is greater than 40. Even some individuals who have a BMI of 35 could actually be at high risk if they have multiple other comorbidities associated with them. So that's another one. Individuals with CKD or chronic kidney disease on dialysis are considered at high risk. Immunocompromised individuals are considered at high risk, and that includes treatments. So for example, there's medications out there that do cause some immunosuppression. So those could put someone at high risk. If someone has to be on steroids long-term for certain medical problems, and it's a long-term higher doses, those individuals could be at high risk. If you have serious underlying heart conditions, those individuals can be at high risk. There's really many different forms, and I'm sure I could keep going on and listing. These are the most important right now that we're informing everyone. But again, keep in mind that in essence, we all could be at risk. And unfortunately, I know that based on what I've seen. I have at the hospital, and it's so disheartening to see any individual affected, but even individuals we've noticed that are very healthy, that didn't have any underlying medical problems, somehow got affected so severe that they're requiring a lot of oxygen. I mean, I have had patients, young patients, who are on 15 liters of oxygen just trying to maintain a stable enough oxygen saturation where they're borderline in terms of when to intubate. So it is important to be careful. As you all know, now even children are starting to show symptoms. So we just all have to be very, very careful at this time, and just assume that we're all high risk to be safe for ourselves and those around us. So another great question. Let's see what else is coming through. Another question that somebody had submitted earlier was, what tips can you give our people and families to prevent and the spread of the novel coronavirus? Thank you for asking that. It looks like some of this was kind of addressed earlier about those safe social practicing that we have in place right now. Now, in terms of families, I'm not sure if this question was also trying to clarify if, for example, a family member, so someone living in your household, gets COVID-19 and they're stable enough that they're at home and they're not requiring to go to the hospital, but you're all living in the same household. So for those situations, you just want to be very careful and try to practice social distancing at that point if a family member is affected, or even if a family member is feeling ill and they're not sure, to do some of that self-isolation in your own home. So for example, if you do have a separate bedroom and an individual in your household who is sick can be in that bedroom, that is advised, as well as if you happen to have a separate restroom. If not, it's okay, just be distant as much as possible. Make sure you are cleaning surfaces as much as possible. If there's, again, an individual in your house who has the disease and they're trying to take care of themselves at home, so wiping down any surfaces that the individual who's sick with COVID-19 may have come in contact to. Everyone in the household should do a lot of soap and water, hand washing. Other things is, again, that separate bedroom. And if you're going to go into, don't share utensils. I had a few patients telling me they contracted it that way. They accidentally took the same utensil. It's okay if you wash it, that's fine. Dishwasher, hand washing, it's fine. But try not to drink out of the same cups or use the same spoons from anyone who's feeling ill. And that's basically the safest way. And in the meantime, remember, household contacts. So if a family member or someone you know, unfortunately, has this disease, the individuals in that household need to undergo that quarantine measure. So if you guys are, anyone in that household is working outside the household, but a family member is ill, it is advised and recommended that you also notify your employer, even the exposures, to inform them that there's an exposure in the household, and at that point you would need to stay home for 14 days. Employers are understanding that, so please don't worry about it. I know some of our patients felt initially that they were afraid to tell them, no, please don't. In fact, employers appreciate it. They want to know. And if you need that work note, off work note, we're here for you. We're giving them as physicians. I've been giving as many as I needed to that was appropriate. Okay? So great. Other question. Oh, we're going to be short on time soon, but I think we still got some more questions. Keep submitting if I didn't get any from the ones you guys submitted. And I think another question here. So this is a great question. Oh, this next question could probably take its own segment, but I'm going to try to answer or come up with as much as I can. So this question says, what are the most common myths about COVID-19 that physicians should debunk for patients? Great question. So, okay, I'm going to have to think of these at the top of my head quickly. So, one of them we're constantly asked is if I wear a mask, then I don't need to, this is an assumption that some people have. If I wear a mask, I don't need to social distance. Or if I'm social distancing, I don't need to wear a mask. Unfortunately, that's not true. While I wish it was to make it easier for everyone, the reason is they go hand in hand. Remember, that mask is a safeguard, but also the social distancing is important because, for example, the 6 feet rule is also not definitive. I want you guys to understand that and know that. We say 6 feet as a minimum, but is it possible that respiratory droplets, if someone sneezes or coughs, spreads further than that? Absolutely. So the more distant you are, the better. Let's say you are confident enough that you're going to go out and about and you're going to avoid everyone and not wear your mask. Well, the problem with that is we can't depend on the others. We can't really control the behaviors of anyone around us, of course, and so that's okay. But we need to practice whatever's safe for us and those around us. So if you weren't wearing your mask, one thing important is to know is, let's say you are being distant, but you just walked by a room or area or at the store or wherever you might be where several minutes before, and you didn't know, you didn't see it happen. Somebody actually coughed and sneezed and they also weren't wearing the mask and they happened to have COVID-19. And these days it's spreading. So you actually can inhale that. And in fact, there are studies showing that depending on the circulation of the area you're in, how small it is, it can hover in the air a little bit longer than people realize. And so you're putting yourself at risk. And honestly, if I know some people will say, well, I'm not afraid, so I'm fine, or I'm healthy and young. But please keep in mind that we have everyone around us too. So if you're not worried for yourself, remember you want to also protect your parents, your grandparents, your children, your family members, your employer, employee, everyone. Because even for me, so I understand this is frustrating for you all. when I was at the hospital setting, and I realize I'm going to be doing this a lot in these next few months, which is okay, it's the new norm, but when I was working in the COVID unit, because remember, we rotate around a lot, I actually was doing my own self-quarantine. In fact, I've only recently been home, I think just over a week or two now. I was going to and from work to the hotel. I stayed at a hotel, and then after my last COVID unit patient, although technically we can still see patients, we are still seeing patients here in all settings, but it was a lot of high exposure and a couple close calls. I actually waited weeks before I returned home. So even myself, I'm being careful. And if any of you see me out in public at the store, I promise you I will be wearing my mask as long as it is required and important to protect you all. Okay? And I think, oh, here's another question before I go on with the rest so I don't miss it. What do you think about kids going back to school using a mask? A great question. And Sidori's giving me a shout out. Hi, Sidori, I miss you very much. Can't wait till it's safe that I can hug you guys again. So this is a little bit difficult. Now, it really depends on the age of the age group, but unfortunately, to protect kids from each other, and especially with kids, it's hard for them. They're not going to know when, or they might accidentally cough or sneeze. So at this time, that's hard because they are putting this in place, and that might be difficult or traumatizing to a child. If that's your case, they're still doing homeschooling temporarily. If you're uncomfortable for your own child and you know your child and you think it's too much trauma to put them through that, consider the homeschooling method or talk to the teachers. They need to be spread apart. I know that one's a difficult one. So another myth that I wanted to go over, that I guess on that other last question, is that the only people who have to worry about contracting or dying from COVID-19 are the elderly. Not true. That's very commonly asked, but we already talked about the risk categories for that. There's another question here. Thoughts on the effectiveness of vitamin C IV for supporting patients with bad COVID situations? So great question. This is another one of those. There's still a lot of clinical trials and things going on. Some will support it, some won't support it. Until we get more definitive answers, and we need to be doing, trials and different things on a mass public and population. So in any treatment, what might work for one person may not work for another. Okay, actually it looks like I have something flashing saying that it's almost the next person's time. It looks like it's 2:59. I hope I got through all of your questions as much as possible. I'm sorry I started talking really fast at the end. I just wanted to make sure we addressed everything. So thank you again to our association for inviting me here today. I so appreciate this opportunity. I can't tell you how grateful I am to connect with you all. Thank you for every single viewer out there and for all those that submitted questions. I truly appreciate it. If other questions come up, and I'm sorry this segment, we had a lot to cover, contact me, send me messages. If you ever want me to do this again, let me know. Reach out to the association or my account, and I'd be happy to. So thank you again. Please, everyone.